We cannot hear you, Minister.
Hello?
There we go. Now we can hear you.
Perfect.
Are you ready to go?
I am.
Thank you. Good afternoon. Will the Committee of Supply please come to order? This section of the Committee of Supply will now consider the estimates of the Department of Health. Does the Honourable Minister have an opening statement?
Thank you, Mr. Chairperson.
The Honourable Minister.
Thank you, Mr. Chairperson. Yes, I do have an opening statement.
You may proceed. Honourable Minister of Health.
Thank you, Mr. Chairperson. On behalf of the Department of Health, I'm very pleased to present the financial estimates for the 2023-2024 fiscal year. I would like to make the following introductions of my team who is joining this committee. Karen Hurd, Deputy Minister of Manitoba Health. Scott Sinclair, our incoming Deputy Minister. Sandra Hanault, Assistant Deputy Minister and Executive Financial Officer, Manitoba Health. Sil Komladi, Associate Deputy Minister, Performance and Oversight Division. Barb Wazalewski, Assistant Deputy Minister, Health Policy and Planning. Louis Barr, Assistant Deputy Minister, Public Health Division. Robert Schaefer, Assistant Deputy Minister, Insurance Division. I commit to Manitobans that through this budget, we will continue to deliver a positive healthcare experience for Manitobans with a focus on quality health services. That care is delivered in a system that is focused on continuous improvement to address capacity, performance, and accountability. We also want to ensure that care is delivered by an empowered, adaptable, and highly skilled workforce. At the same time, we oversee the system in a manner that ensures this care is sustainable for current and future generations. The health system is recovering from the impacts of the pandemic. There's a global health human resource challenge. So we will continue our health human resource action plan to meet the significant demand for healthcare professionals across Manitoba, and we will continue our commitment to address surgical and diagnostic wait lists arising from the COVID pandemic using innovative solutions brought through the Diagnostic and Surgical Recovery Task Force. The proposed 2023-2024 health budget in CORE represents the largest investment in healthcare in our province's history. Just over $6.7 billion as it resides today. More specifically, the Department of Health now reflects a 2023-2024 expenditure in CORE of $6.778 billion and 729.3 full-time equivalent positions. This represents $503.5 million increase from the 2022-2023 budget, or an 8% increase. In terms of summary financial reporting, the 2023-2024 health sector summary budget is set at $7.133 billion. Budget 2023 includes key investments and enhancements in the delivery of health services. I will now take a few moments to describe some of these investments. Manitoba Health takes the fiscal imperative of this government very seriously. This means weighing carefully our options that maximize patient outcomes and quality of care, along with protecting the sustainability of the healthcare system. A substantial driver of this increase, around 47% of this, is for frontline healthcare remuneration. This includes the estimated financial cost of the successful conclusion of major collective agreements in the health sector for nursing and support staff. It also contains a volume increase estimate related to physicians. Another substantial portion of health's increase is due to the largest ever percentage increase in the drug budget so that we can continue to keep up with the rising costs of pharmaceutical treatments. The drug budget includes two major programs, PharmaCare and the Home Cancer Drug Program. PharmaCare is a universal, comprehensive, income-tested prescription drug program for all Manitobans, regardless of age. It covers 100% of eligible drug costs once the income-tested deductible is reached. The Home Cancer Drug Program budget was established in 2012 and has provided oral chemotherapy drugs to eligible residents at no cost, with no deductible, in order to work consistently with the intravenous drugs provided through Cancer Care Manitoba, also at no cost to clients. The drug budget increases in Budget 2023 ensure that we continue to provide Manitobans with innovative and life-saving drugs and therapies. The Manitoba government also continues to recognize that significant financial resources are needed to address the pandemic backlog challenges. Budget 2023 provides a total of $130 million, an increase of $20 million over Budget 2022 to aid in the recovery from COVID-19 related to surgical and diagnostic backlogs. This will be available to health through an internal service adjustment within enabling appropriations. Manitoba's made significant progress on eliminating the COVID-related backlogs in many key areas, including ultrasound, pacemaker, cath lab, cataracts, oral surgery, and dentistry, as well as urology and CT scan. There is more work to do, but significant progress has been achieved. An additional investment of $9 million is provided to maintain the elevated ICU bed levels that first increased under COVID-19. Combined with Budget 2022 totals, this results in an $18 million total investment to maintain these elevated ICU bed levels to this date. Work is also concurrently underway to assess the ongoing ICU bed needs in our province. This means that our ICU configuration plans, once the COVID pandemic is declared over by the World Health Organization, will adjust to the most up-to-date and evidence-informed assessment of critical care beds. Health has also made large commitments related to the Health Human Resource Action Plan, focusing on recruitment, training, and retention of healthcare providers across Manitoba. 36 initiatives were announced November 10th of 2022 that build on existing actions that are already underway. $129.6 million will be available to health through an internal service adjustment within enabling appropriations. There are also strong linkages between the Health Human Resource Action Plan with our Clinical and Preventative Services Plan. Under the training pillar of the Health Human Resource Action Plan, a notable announcement was made a few weeks ago by Minister Guimard and myself regarding $2.1 million to Assiniboine Community College to offer a one-time 25-student cohort for its practical nursing diploma program in the community of Neepawa. The benefit of the ACC program is that nurses from rural communities are more likely to stay or return to rural health settings. These graduates of this program will be eligible to fill positions at the new hospital under construction in Neepawa, which is well on track to a completion scheduled in 2025. On the recruitment pillar of the action plan, also notable is that we have completed a request for expression of interest for physician recruitment services, which will help us arrive at recruitment firms specializing in physician recruitment through a finalization of that selection process via a request for proposals. We are also working with our regulators to streamline and modernize the path to credentialing in Manitoba. The College of Registered Nurses of Manitoba recently publicized the steps it has taken through our work with them to modernize and streamline registration processes for nurses. IENs already in Manitoba, retired nurses wishing to return to nursing practice, and recruitment mission nurses. This announcement included details of its expedited pathway for the targeted recruitment of internationally educated nurses, in addition to significant updates to how applicants may demonstrate language proficiency, clinical competency, and return to practice. As part of the modernization efforts, applicants will now have 3 additional ways to demonstrate English language proficiency, including current or recent registration within the past 2 years as a licensed practical nurse
The
or registered.
minister's time has expired. I'd like to thank the minister for those comments. I'd also like to remind everyone in the chamber here, not chamber, in the committee room, that when referring to another member, that the name should be the constituency or the title. You cannot use people's names. So we will now continue. Does the critic from the official opposition have an opening statement? The honourable member for Union Station.
Thank you. I'd like to welcome the minister, welcome all folks, all the clerks and all the folks who are making estimates possible today and for the duration that we'll be conducting estimates. As always, I'm pleased to be here and to bring attentions to what is Manitobans' absolutely #1 priority, that is healthcare. And so I want to be clear about the estimates that we're going to be asking questions about in the budget. This is very plainly an election budget that the government has brought forward, and an election budget is about trust. After 7 years of underfunding by this PC government, this year is no exception. The current Premier has unfortunately continued Brian Pallister's attack on healthcare, which is having devastating impacts on the health care and health outcomes of Manitobans. We see that Manitobans are left to deal with chaos in our healthcare system. We see even today the impacts of this government's cuts, mistreatment of healthcare workers, and mismanagement with healthcare workers that we depend on continuing to leave our healthcare system in droves. The minister, we hear on a regular basis talk about announcements. Unfortunately, we know that this government's pattern is to make announcements and not follow through on any commitments. We also know that this government has no actual strategy to repair the damage they've done to healthcare. Their cuts, closures, and consolidation, and promised, couch tours instead of sitting down with frontline healthcare workers like nurses, have thrown our system into absolute chaos. And I want to also be clear in saying that all started before the pandemic and has only since gotten increasingly worse. And so I would like to start the estimates process here, asking some questions around appointments in the minister's department. So can the minister undertake to give? Oh, thank you. Okay.
We thank the member for those comments. Under Manitoba practice, debate on the minister's salary is the last item considered for a department in the Committee of Supply. Accordingly, we shall now defer consideration of line item 21.1 brackets A contained in Resolution 21.1. According to our Rule 78 bracket 16, during the consideration of departmental estimates, questioning for each department shall proceed in a global manner, with questions put separately on all resolutions once the official opposition critic indicates that questioning has concluded. The floor is now open for questions. The honorable member for Union Station.
Thank you so much. I'm actually heading off now to meet directly with real-life frontline healthcare workers, nurses, and doctors that know, unfortunately, the hard truth of this PC government's cuts to healthcare. And I'm going to turn questions over to my wonderful colleagues who are incredible champions of healthcare in the North and the communities they represent, as I know they also have a lot of unanswered questions. Thank you.
The honorable member for Flin Flon.
Thank you, Mr. Chair, and I welcome the opportunity for us to have a discussion and ask some questions, particularly in relation to Northern Health and Northern Health Care. I know that recently they've appointed a new CEO for the Northern Regional Health Authority, with the former CEO retiring, moving to a different area. Can the minister explain to us what all consultations took place between various groups throughout the North before the new CEO was hired?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I am not part of the hiring process for the CEO for the Northern Regional Health Authority. That is an internal process that is delegated to the to the human resource team at the Northern Regional Health Authority.
The honorable member for Flin Flon.
Thank you, and I thank the minister for that answer. I do have some concerns around the recent hire. I know I'd had conversations earlier with the Grand Chief from MKO, recognizing that probably, I don't know what the exact number, but the majority of residents in northern Manitoba are in fact Indigenous. I know that he had hoped that perhaps maybe there would be some move towards having an Indigenous CEO to lead the Northern Health region. Has the minister had any discussions with either the Grand Chief of the MKO or any of the other northern chiefs that represent the majority of people in the North about that particular issue?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I recall seeing the ad go out publicly. Anyone in Manitoba and anyone who felt that their qualifications met the requirements of the position could apply, and it was a public and transparent process. And again, the applications were open to all. But I do want to focus today's committee on what we're here to discuss, which is Budget 2023 and the supplements to the estimates of expenditure for 2023-24 for Manitoba Health. If we could refocus the questions to the estimates, please.
The honorable member for Flin Flon.
I thank you, and unfortunately these questions are questions that are important to people in the North and are part of the importance of the budget process. which is why we get to ask questions in a global nature without specific, always saying something to do with a number. So we know that the Northern Health Region offered an apology to the Northern Indigenous folks because of the racism that was felt to be directed specifically against Indigenous peoples. So can the minister tell us what actions her department has taken to address any of those racism issues in the Northern Health Region?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Neither I nor my government will tolerate racism in any form, especially within our healthcare system. It is important to our government that First Nations leadership and health professionals have a direct role in developing and implementing healthcare plans that prioritize First Nations people on and off reserve, as well as northern and remote communities. I have met with Grand Chief Garrison Settee of MKO and Dr. Barry LaValle of Kim to continue the discussion of improving health and wellness services in northern Manitoba and for advice on other ways to fight racism in our healthcare system. Shortly before that, I hosted a Northern Healthcare Sustainability meeting in Thompson, where over 30 Northern leaders and stakeholders were there to talk about how to fight racism in our healthcare system. That was one of the top issues that we discussed. Manitoba, as you know, is at its best when First Nations leadership and health professionals are at the table, helping make the best decisions for their people and communities. Our government continues this relationship by investing the largest amount in Manitoba's history, $812 million in budget 2021, to improve healthcare in rural and northern Manitoba. A significant portion of that investment will be used in the creation of a northern intermediary healthcare hub. We are excited to be working with our First Nations and Northern partners to reduce the need to travel to Winnipeg and allow for better care closer to home. Moving forward on our joint statement to end anti-Indigenous racism in healthcare. Our ongoing joint Kim and Northern Regional Health Authority co-planning process on sustainable healthcare delivery in the region. We want to create a wisdom council. We want to add elders as part of the Northern Regional Health Authority care team. The addition of a social worker who will focus on supporting Indigenous patients in the emergency department. Spiritual care includes access to Indigenous ceremonies like smudging, expanding cultural training, which includes First Nation inspired land-based education for staff and our board of directors. These are all on top of initiatives underway with the province and the feds, which they can speak to. We understand and we all want these solutions implemented without delay, but it will take work and time to solve this very complex, multifaceted issues. We are committed to working with all of our partners, especially our Indigenous communities and leadership, to find and implement sustainable solutions that meet the health needs of the people we serve in support of our vision of healthy people, healthy North. And I want to also acknowledge the monumental work done by Manitoba's chiefs, councils, and the Manitoba First Nations pandemic response team in keeping their communities safe over the course of the pandemic. Over the last 2 years, over 300,000 vaccine doses have been administered to First Nations in Manitoba, and 89% are fully vaccinated in our 63 First Nation communities in Manitoba. It is important to our government that First Nations leadership and health professionals have a direct role in developing and implementing healthcare plans that prioritize First Nations people on and off reserve, as well as northern and remote communities. Manitoba is at its best when First Nations leadership and health professionals are at the table, helping to make the best decisions. We are going to continue to consult with Indigenous and First Nations communities. We're going to continue to meet around the table of solutions. We're going to talk about the issues such as those that have been raised by the member for Flin Flon around racism in the health system. We take it very, very seriously, and our government wants to root out and eradicate all forms of racism in healthcare. And I know the member is focusing his questions on the North, but we want to root that out and eradicate racism all across Manitoba. We're not just focused on the Northern Regional Health Authority. We're focused on Winnipeg, the Southern Regional Health Authority, Interlake. Everywhere we want this to be reduced.
The Honourable Minister's time has expired. The Honourable Member for St. John's.
Miigwech. The Minister's final comments were in respect of rooting out racism everywhere, which is great. I would suggest to the Minister if, and we have said this many, many times in the House, outside the House, across our territories, across Canada, I would suggest that she can start by being very cognizant of the language that she uses in respect of Indigenous people. In her comment, she said, our Indigenous people. I know that for myself, I have stood up in the House many, many times to correct government members when they say our Indigenous people. It is very important, the language and the discourse that is used. And I will share, our Indigenous peoples is very patronizing. And it actually finds itself, its history, in Indigenous peoples being the ward of the state. That is the language where that comes from. So I would ask the Minister to make sure that she no longer uses that narrative, that it is just Indigenous people, not our Indigenous people. We as Indigenous peoples don't belong to anybody. We have always been here. These are our territories. We are sovereign nations. We are independent peoples, and we're not the property of anybody. And along that line, I would ask the Minister to share what the plan is in respect of her government and her administration's plan to increase abortion access in the North. I know that several of our members have brought up for many years now, but certainly in the last little while as well, the lack of access to abortion in the North and the detrimental effects that has for Manitobans living in the North that are not able to access what is essential health care and what is a human right. So I would ask what the plan is in respect to the PC government ensuring that there is access to abortion in the North.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. And I thank the member for St. John's for the question. Since 2019, our government fully covers mifegamieso for Manitoba residents, regardless of where they live in the province. To help with accessibility, all Manitobans can access the drug at their local healthcare practitioner, community pharmacy, or nursing station. And we also provide virtual accessibility options for individuals to talk to their care provider. Thank you, Mr. Chairperson.
The Honorable Member for St. John's.
Miigwech to the minister for that response. However, the minister will know that mifegamieso is only one component of abortion access, right? And the minister should know that mifegamieso is only is not universally available because there are criteria to be able to prescribe mifegamieso. One of the criteria is that you are pregnant 8 weeks or under. So anything above 8 weeks, as the minister should know, requires a surgical abortion. And so I appreciate, and I will put on the record here, that the government pays for mifegamieso, and I will put on the record that that is because of the NDP and the work that myself and other members did here alongside doctors who were in school. I think the minister will remember this, who started a campaign to ensure that mifegamieso was made universally free to folks. So that work was done because of our lobbying and for folks at becoming doctors. So I think that's really important. But again, the question about access to abortion. And let me just say this as well, like mifegamieso, not everybody, and the minister will know this or should know this, that in order to prescribe mifegamieso, doctors have to go for training. And the minister will also know that there are doctors in Manitoba that will not take the training because they don't believe in abortion. They will know, the minister will know that there are pharmacies, not many, thank God, but there are pharmacies in Manitoba that will not dispense, they will not carry mifegamieso, and they certainly won't dispense it if there is doctor's prescription. They just won't do it. So I know that the minister referred to mifegamieso as if it is the end-all and be-all in respect of abortion access, but actually there's quite a bit of obstacles in accessing mifegamieso. So put that aside. Again, mifegamieso is only one small component to abortion access. So my question to the minister is, what is her department's plan moving forward in respect of abortion access? And right now, the question, because we're concentrating on issues in the north, so my question in respect of accessing abortion is specifically about the north, but actually as well, accessing surgical abortions in the city and other cities like Brandon and is actually increasingly more difficult as well. So, but for right now, I would ask the minister, what is the department's plan to increase access to abortion in the north, other than mifegamieso, which is only good until you are 8 weeks pregnant?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for St. John's for the question. I do want to, for a moment, point to our clinical preventative services plan. And there is a specific chapter within that plan that speaks to women's health. And I just want to share some information from that chapter in terms of how the clinical preventative services plan was developed. So nearly 300 provincial clinical team members analyzed data, reviewed lead-in practices and models of care from other jurisdictions, and developed a plan to improve health services for Manitoba patients. 11 teams organized around specialty areas of care like primary health and community services, mental health and addictions, chronic and complex medicine, and women and child health. Reviewed data, models of care and outcomes, analyzed the needs of specialized populations, and assessed opportunities to improve access, coordination, and quality of care. Cross-clinical working groups with expertise in Indigenous health, quality and patient safety, digital health, diagnostics and emergency medical services, and patient transport worked across all teams to ensure the recommendations were integrated into a provincial plan that is appropriate for the needs, acuity, and geography of Manitoba's population. The healthcare needs of any population are constantly changing, and the plan was adapted to ensure the services delivered and the providers who deliver them are able to adapt while ensuring a continued focus on accessible, equitable, and quality care provided by skilled healthcare professionals. And I just want to share with you some of the next steps. Clinical planning workshops have focused in on the success of health system in other parts of the country and around the world, identifying the improved outcomes and easier access to care that have been achieved by implementing integrated health systems. Planning is patient-focused, taking careful consideration of the need to improve the experience and access of Manitoba's unique patient population, while looking at lead-in practices in use in other jurisdictions, as well as innovative practices and pilot projects already in operation in parts of Manitoba's health system. So across the provincial clinical teams, opportunities have now been identified to lay the foundation for improved models of care, guided by leading practice and evidence to build the capacity necessary to ensure the appropriate expertise and optimal technology exists to deliver care while monitoring and measuring improvements in patient quality and safety. Elements of the proposed model of the future, including necessary enhancements to capacity in order to allow for consistent access to clinical expertise, including enablers like digital health and diagnostics to that Manitobans can continue to, or healthcare providers can continue to meet, to refine the model of Manitoba's population. So we have developed our clinical preventative services plan by taking the advice and the direction of healthcare providers in the system, Mr. Chairperson, that looked at one of the specialty areas being women and child health. And we are moving forward with the advice of those individuals. And the Manitoba government and all regional health authorities remain committed to providing the best possible care for women and their families. I have a list of notable increases that have occurred since our government took office in 2016 in women's health. And I want to point out one of them in particular that just happened about a month ago. More than $300,000 in continuing annual funding was invested by our government to support the provincial eating disorder prevention and recovery program at the Women's Health Clinic, which offers outpatient community-based treatment. So, Mr. Chairperson, our government has not remained static in terms of supporting
Honorable
women's health.
Minister's time has expired. The member for St. John's.
That's a really disappointing answer. Like, it's super disappointing. It's disappointing in the fact that, I mean, what do ministers make? They make like $150,000, something like that. And you would expect that a person who's elected to represent their constituency, but then has like the absolute privilege of being named to cabinet, to be a minister. You know, there's been, you know, a little over 800 people in the history of Manitoba, that have ever been elected to sit in these rooms, to have these positions in cabinet. Very, very few folks, you know, that get the privilege, the awesome privilege to be the Minister of Health. And as I have said many, many times in the chamber, all of us, even just a backbench MLA like myself, it is such a sacred responsibility that we have to work on behalf of and for Manitobans. And so to hear the minister read off some report, but not be able to answer the question that I'm asking that actually affects Manitoba lives is disappointing. It's so disappointing. Nowhere in that in the minister's answer did she even utter the word abortion, which is, you know, we've seen previous ministers before her that couldn't utter the word abortion. Like, abortion is not a dirty word. It's not a bad word. It is healthcare. Manitobans have abortions. They have the right to have abortions. They have the right to access abortions. They have the right to have as many abortions as they want. And the fact that this minister can't even say the word abortion is quite disappointing, and then cannot even answer my question about what is she going to do to make sure that abortion in the North is accessible, that there are actual services to have abortion. Folks should know in this room, even though I am the only woman in this room sitting at this table, everybody should know that accessing abortion is time sensitive. It's time sensitive. And Manitoba, folks that live in the North have to deal with a variety of different issues that put obstacles in their way to be able to access, even when all the stars align, there are obstacles in the way to be able to access healthcare. But when you are pregnant and you are choosing not to progress with that pregnancy, it is time sensitive. So I'm asking the minister to earn her $150,000+ a year salary and answer the question on what she's doing to ensure that Manitoba citizens can access abortion in the North.
On a point of order?
Point of order, Mr. Chair. I've never had somebody, after all these years of having health.
Oh.
Maybe tweaking his name. So
The member for Verdun?
well, no, it's for Turtle Mountain.
Turtle Mountain.
Yeah, all these years that I've been in as an MLA for 9 years. We had health ministers that I had to, sit here in these chambers and listen to people, ask them questions. But I've never seen such a disrespect for our health minister right now. I value her expertise, her wisdom. She comes from the healthcare sector herself. My wife, who's also half Jamaican, I feel that there's a disrespect here from the member from St. John's here. And I'll stand up and say that. Because I think our minister, I think there's something to be said here. That minister from St. John, the MLA for St. John's, has gone over the edge here when it comes to our minister from health.
The member for St. John's on the same point of order.
On the same point of order, I really don't care. Do you realize how bad healthcare is in Manitoba? Do you realize how bad healthcare is in Manitoba? Do you realize there are Manitobans that cannot even have their babies in their home community because there's no infrastructure for them to have their babies? Do you realize that? Do you realize that Manitobans have died under your watch? Under her watch? Under every other
I'm
minister's
interrupting this point of order. It's not a point of order. It's a dispute over the facts. And basically, we're here to discuss the estimates books. It's not a debate, and a point of order, it's not a point of order. We will continue. And the behavior is something that we need to take a serious look at. We won't get any place by yelling and shouting at each other. There's no point of order. It's a dispute on the facts. We will continue now. The member for St. John's.
So I think I had actually already finished my question. And so the question remains what the Minister of Health is doing to ensure that Manitobans have access to health care in the form of abortion in the North.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I want to also reiterate what you have said, Mr. Chairperson, that we are here to consider the supplement to the estimates of expenditure for the budget 2023-2024 for the Department of Manitoba Health. I encourage the member for St. John's to focus on the estimates process and to respect the time and that all the members around the table on both sides have dedicated and committed to this process so that we can go through the estimates for Manitoba Health and to stay on topic and not turn this highly respected process into a circus, Mr. Chairperson. And so I want to also respond to the question that Budget 2023 includes nearly $8 billion in historic investment into our healthcare system, which provides $668 million more to strengthen healthcare for Manitobans in the North, in rural communities, in Winnipeg, all Manitobans. Healthcare has always been a top priority of this government. The budget affirms our commitment to healthcare by making it stronger and more sustainable for all Manitobans in the years to come. $130 million in funding dedicated to reducing surgical and diagnostic backlog. $120 million to the pharmacare program, including extending the coverage for insulin pumps for adults with type 1 and type 2 diabetes. The Health Human Resource Action Plan. We're continuing to implement the $200 million investment for our frontline workers. We're providing $1.2 billion in multi-year capital investments for expansion and improvements on rural hospital or other health infrastructure, in addition to the renovations of several Winnipeg facilities, including St. Boniface Hospital, Grace Hospital, Cancer Care Manitoba, and the Health Sciences Centre. This budget demonstrates our commitment to creating a better, brighter, and stronger Manitoba. 22% increase in healthcare funding since our government took office in 2016. And here are some of the announcements. I know the members opposite call them big announcement, and I actually want to thank them for that because I never thought of using that term, but they're big announcements. 80 new physician training seats, 40 undergraduate physician seats, 10 international medical graduate seats, 30 two-year postgraduate medical seats for internationally educated medical students, premiums offered to family and pediatric clinics to extend patient hours, 450,000 for physician mental health supports through the peer support program, $6.6 million for the creation of a specialized CAR T cancer care therapy program, $5 million to create the new emergency care services vectors to virtually support patient transfers, $200 million, again, for the Health Human Resource Action Plan to add 2,000 additional healthcare professionals to end the mandating of overtime. $12.5 million for a new nursing simulation and training center at Red River College Polytechnic. $482,000 for respiratory therapy program. New training seats at the University of Manitoba, raising the seat total to 20, an increase of 20%. And then my all-time, all of them are my favorite, but I'll tell you, when I met 6-year-old Sam, this one really stood out for me. Trikafta, expanding coverage for the cystic fibrosis medication to patients age 6 and older. $50 million for the Health Sciences Center Operation Excellence to increase Health Sciences Center surgical and diagnostic capacity by 25%. $750,000 for the Health Sciences Center Children's Hospital inpatient monitor upgrades to support 26 inpatient monitored beds. $2 million for the Swan River CT scanner. $800,000.
The honorable minister's time has expired. The honorable member for St. John.
So I will note again that the question is about abortion access, which is a very serious issue for many, many Manitobans. And once again, the minister took her full 5 minutes, read from the book, and not once uttered the word abortion. I mean, I don't know how, this is now my third question asking about abortion. The minister should be able and should be willing to answer these questions. They are important questions for Manitobans in accessing essential health care. And the minister has now wasted 15 minutes not answering these questions. I'm going to try again. Again, I'll remind the minister what the 3 questions were. What's the plan to increase access or have access to abortion in the North? But I'm going to add to that, maybe we'll get an answer. Can the minister tell the committee how many Manitobans accessed the abortion pill, Mifigay-Miso, in the 2022-2023 fiscal year? And can the minister also advise how many Manitobans received surgical abortions for 2022-2023 fiscal year? And would she have a breakdown of which sites performed those services?
The Honorable Minister of Health.
Thank you, Mr. Acting Chairperson. I can now respond to the member for St. John's question. I do want to refer the member to the Clinical Preventative Services Plan, which is a public document that is available on the worldwide website, internet, Google Chrome. It can also be searched there. And on page 61, specifically page 63, lays out very comprehensively the service standards and provider roles for women's health right across this province. So I would encourage the member to take a look at that section as we now return our focus to the budget 2023 supplement to the estimates of expenditure budget, again, 2023-24 for the Department of Manitoba Health. Thank you, Mr. Acting Chairperson.
The member for St. John's.
Yeah, I think it is, you know, again, I can't stress how disappointing it is to hear the answers from the Minister. The Minister of Health, who is responsible for a pretty big department, and to give answers like that is absolutely just shameful. To take all of that time and just really play around with a process here where we're trying to get answers that on issues that affect many Manitobans. It's quite shameful, the answers that the Minister is providing. Again, I will ask one more time before I hand it over to my amazing colleagues here who actually, you know, care about Manitobans in the north, that know what's going on in the north, and I'm sure have many amazing questions to ask the Minister. But again, I would ask, what is the plan to have access to abortion in the north? How many Manitobans accessed the abortion pill in the 2022-2023 fiscal year? And how many Manitobans received surgical abortions in the 2022-2023 fiscal year?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. We will take the question from the member for St. John's under advisement.
The Honorable Member for Flin Flon.
Well, thank you, Mr. Chair, and I realize that my colleague from St. John's asked repeatedly about abortion in northern Manitoba and the access to. The minister has refused to answer that question repeatedly. So she wants to talk specifically numbers. So can the minister please tell us how many surgical abortions took place in northern Manitoba in the last year and the year before that?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Flin Flon for the question. We will take that question under advisement, Mr. Chairperson.
The Honorable Member for Flin Flon.
So then I'm assuming the minister doesn't really want to talk about the numbers and budget. Can the minister then, if she can't tell us what the number was for last year, can she explain in her budget what the increase or decrease in the amount that will be budgeted to perform surgical abortions in the north, so that women in the north actually have some sort of equitable access to that health care?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Flin Flon for the question. It gives me an opportunity to provide some, to raise awareness about how funding is allocated to the regional health authorities. Global funding is provided to the health authorities. We don't fund procedure by procedure. The regional health authorities receive global funding. They then carry out an assessment of the needs of their specific communities within their regions and determine how much funding is allocated for the various sub-appropriations. And I'll give you an example. If the member wants to turn to page 51 of our estimates document for Manitoba Health, there are several sub-appropriations that are funded to health authorities. And so the member is asked about the increases that we've made. Well, you'll see there on page 51, the increases that have been made in acute care services funding to service delivery organizations. There are increases to long-term care services, funding again to service delivery organizations, more increases to home care services, funding to service delivery organizations, community health services funding to service delivery organizations, and emergency response and transport services funding to service delivery organizations. And at the top of page 1, it actually gives a breakdown of what the services mean? So acute care services provides funding to health authorities, Cancer Care Manitoba, and Shared Health to provide services delivered within acute care settings. Funding for the acute care sector encompasses operating funding related to compensation, supplies, and drugs required to operate acute care facilities and programs. Long-term care services provides funding to health authorities to deliver services to provincially licensed personal care homes. Funding for the long-term care sector includes operating funding related to compensation, supplies, and drugs required to operate long-term care facilities. Home care services provides funding to health authorities and Shared Health to provide home care and related services required to enhance patient care in their homes. Funding for the home care sector is largely comprised of compensation and supply costs. Then it explains community health services, provides funding to health authorities and Shared Health to fund services provided through community health agencies. Emergency response and transport services provides funding to Shared Health for emergency response services across the province, as well as funding to health authorities for the Northern Patient Transport Program. And so if the member turns with me, I see that the member doesn't have the actual estimates document at his disposal, right? That is what we're here in committee to consider, the estimates documents for 2023-24 for the Department of Manitoba Health. But when he does have that document in front of him, he could turn to page 51 and remember the section that I pointed to that shows significant increases in all the areas that I've pointed out. And that, once again, global funding is provided to the regional health authorities. They assess the needs of their individual communities. They do that in consultation with the stakeholders. And I would imagine that the Northern Regional Health Authority does the same as the other RHAs and consults with their stakeholders to identify the areas of need and where the global funding they receive will be allocated. And so again, we do not provide or we do not fund procedure by procedure. We provide global funding, which is shown here in the document we're here in committee to consider. And the regional health authorities then decide in consultation with their stakeholders how the funding will be allocated. And we support the work of our regional health authorities and our leadership team. I want to thank them for their commitment to Manitobans and to all the healthcare providers. We refer to them as our healthcare heroes who provide care to Manitobans on a daily basis. Thank you, Mr. Chairperson.
The honourable member for Flin Flon.
I thank the minister for the answer. I'd thank her even more if I actually got an answer to a question. She continues to just read from documents without actually answering any of the questions that have actually been asked. So let's talk about the Northern Patient Transportation Program. We know that it's been a number of years since it was established. The policy has never actually been updated. It's still written in its original, I believe it was 1995 iteration. I know that when the NDP was in government, they had expanded some of the areas that were covered for Northern Patient Transportation because some of the procedures that were being performed, like MRIs, didn't exist back in 1995. So other things were covered and amounts changed. Unfortunately, what they didn't do was update the policy. We know that since this government has come into power, that the amount of money that has been spent, never mind the amount budgeted, because most of the numbers that even the member from Steinbach, when he was the health minister, most of the numbers that were in the budget weren't really meaningful numbers when it came to what was actually spent, because year after year, they underspent that, specifically that particular budget. And there was millions of dollars removed from that budget as early as the first year after the PCs took over. We see the problems that it's presented for people in northern Manitoba accessing healthcare. So can the minister then give us a breakdown of not the budgeted number necessarily, but the actual money that has been spent on northern transportation for the last couple of years, and give us the number of patients that have also accessed that service, so that we have a comparison as to if less money was spent, was there less people that had to access healthcare somewhere else, or was there in fact more people and just less money spent?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I do want to thank the member for Flin Flon for raising the Northern Patient Transport Program because I do want to look at the record of the NDP in terms of that program. Under their watch 7 years ago, the Northern Patient Transport Program was crumbling and underutilized because it was terribly underfunded. And our government, since taking office, has more than doubled the funding of the program to $18 million. Now, 20,000 Northern Manitobans, twice the amount, Mr. Chairperson, under the NDP are served every year. double the funding, double the results. And when we talk about the budget sits in the Northern Regional Health Authority. The majority of individuals who access that service are from that region. And during the pandemic period where people were staying closer to home and may not have been accessing the Northern Patient Transport Program, perhaps, I don't have the exact numbers, or can corroborate what the member is saying. Perhaps they may have underspent in pandemic years. We can check that. But I know one of the things we moved very quickly to do for individuals living in remote northern and rural communities was to allow for the introduction of virtual tariffs, where an individual living in a remote northern or rural community could access care virtually by providers throughout that were anywhere in the province. And we've continued those physician virtual tariffs as well, because the feedback we receive from Doctors Manitoba and from patients, for that matter, is that they wanted to continue to have virtual access to their care providers instead of having to travel far away from home and their support system. And if I can just talk again about the $812 million our government has allocated to the Clinical Preventative Services Plan that will allow for the creation of an intermediary hub. And the focus of that is care closer to home, so that individuals are not having to travel. But when they do, because we recognize there are some acute trauma and serious cases where a person does have to leave their community, that our Northern Patient Transport Program is there for them. It is properly funded. Again, 20,000 Northern Manitobans are served every year. And we no longer have a crumbling and underutilized program as we did under the former NDP government. And we look forward to making more investments in this program in the years to come, Mr. Chairperson. There are some other investments that I want to point to under the Clinical and Preventative Services Plan, in addition to the $812 million, this is all within that funding. 90-bed new hospital in Portage La Prairie, 60-bed new hospital in Neepawa, $70 million to enhance and add 30 additional beds at Brandon Regional Health Centre, $32 million to enhance and add 23 additional beds at Steinbach's Bethesda Hospital, $64.4 million to enhance and add 24 beds at Boundary Trails, $31.6 million to enhance and add 30 additional beds at the Selkirk Regional Health Centre, $5 million for a new emergency department in Dauphin, and $10.8 million to enhance and add 12 additional beds at the Lakeshore General Hospital in Ashern. So you can see, Mr. Chairperson, that we are making investments all over this province. And again, a significant portion of the $812 million will be used in the creation of a new intermediate healthcare hub in northern Manitoba. And currently, teams are engaged with Indigenous leadership and stakeholders to help lead the co-planning for all the projects. We are excited to be working with our northern partners to reduce the need to travel to Winnipeg and allow for better care closer to
The
home.
minister's time has expired. The honourable member for Flin Flon.
Well, it was an answer, I guess. It didn't answer the question, but the minister did touch on a couple of things in her answer that I have to question further on, because one of her catchphrases is care closer to home, and she talks about an intermediary health facility that somehow is magically happening, I'm assuming in Thompson, because we certainly haven't seen any investments in healthcare in Flin Flon, and I'm not sure that my colleague from Thompson sees any investments there either. So, you know, I wonder what the minister thinks care closer to home actually means in the north. I mean, to get from Flin Flon to Thompson is 4-hour drive on a good day, and buses don't really operate back and forth with any kind of regularity. In fact, there may not be buses going there a much longer period. I know I've had constituents that had to find a ride from Flin Flon to the Paw when they were suffering acute appendicitis, sat in the Paw for a number of hours to determine that, yes, in fact, they did have appendicitis, because, of course, Flin Flon doesn't have any of the modern diagnostic equipment anymore. Unfortunately, the one and only surgeon in the Paw wasn't there that day, so then they had to find a way to get this gentleman to Thompson, because apparently there was a surgeon that was available in Thompson. Of course, there was only one surgeon in Thompson, and he was busy dealing with some other issues. So this poor person finally got care, I think it was like 12 hours after he initially presented at the emergency room in Flin Flon. And his condition had obviously worsened in that period of time. So can the minister explain how she believes there's care closer to home for anybody in the north? I've given her one example, but I mean, there's people that are coming from Lynn Lake, people coming from Leaf Rapids, that their hospitals are completely shut down now thanks to this minister and this government. There's no care there, and that is their home. So can the minister explain how in any way, shape, or form that is care closer to home?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. Again, I know the member for Flin Flon doesn't have the actual estimates document at his disposal today, so I do want to flag for him on page 23 of that document that we're here to consider, the supplement to the estimates of expenditure for budget 2023-24 for Manitoba Health, page 23. It states at the top, implement an integrated provincial health system that is aligned with the Manitoba Clinical and Preventative Services Plan. And it also has a heading that says key initiatives and investments. And there's a long list of investments that are being provided across the province, and that the member for Flin Flon can take a look at in terms of his question and the services that are being provided. Thank you, Mr. Chairperson.
The Honorable Member for DePauw-Kamisak.
Yes, thank you, Mr. Chairman. Minister, I just wanted to ask a question about systemic racism within hospitals. I just currently got back from a walk-in clinic accompanying my 20-year-old daughter because of the treatment that she received when she tried to get treatment. She's a young, beautiful Indigenous woman, and the doctor treated her like a pill popper. She wanted something for time management. So I went in and skipped question period so I can accompany her and protect her, right? So I come from a town of the Paw, and just about every week I get a call or people stop me when I'm shopping or just driving, or even come to my apartment here in Winnipeg to talk about systemic racism within the Paw. And I even had to deal with casework where one individual had to be fired because of the words used towards a patient, a cafeteria worker, okay? So I know there's initiative to, you were working with MKO, Dr. Barry LaValle. He was leading that initiative. So tell me exactly, what is this going to do where people such as my daughter this afternoon, Indigenous girl, is not going to be treated like a pill popper when she just wanted pain management for a 3rd-degree burn on her leg? And what's going to happen in my hometown where I've been treated badly as an MLA. I was wearing a baseball cap and sweats. Nobody recognized me, but I was treated badly, and I told the doctor that he should redo his bedside manner course in kind of a nice, rude way. So please tell me and share me, how is that going to be rolled out with staff, medical, to understand the Indigenous issues that were there, I even got treated with discrimination because the fact that I'm treaty and I get medicine for free, some of it for free. And, it's that attitude that needs to disappear. Agasa.
The Honorable Minister of Health.
Thank you, Mr. Chairperson, and I want to thank the member for the PA, Kamisak, for bringing this situation forward. Our government and myself as the health minister condemns all forms of racism and discrimination in the health system. And I was very pleased to be part of the group of stakeholders who in September of 2022 signed the declaration to eliminate all forms of Indigenous specific racism. And it is, as I said before in my opening remarks, we need to root out and eradicate all forms of racism and discrimination. And it is going to be a process that requires many, many steps. And I do want the member to know that a steering committee and action plan has been developed. Manitoba's Disrupting Racism Steering Committee was created to support the development, implementation, and evaluation of policies and strategies intended to progress Manitoba's health system towards dismantling systemic and structural forms of racism and to eliminating racism and discrimination in all healthcare interactions. Now, the action plan has been endorsed by all the CEOs of the 7 service delivery organizations. And the steering committee includes representation from each service delivery organization, Manitoba Mental Health and Community Wellness, the University of Manitoba, Rady Faculty of Health Sciences, First Nation and Inuit Health Branch Manitoba, the Manitoba Association of Newcomer Serving Agencies. So 4 working groups have been established. The Racial Climate Survey, the engagement, policy, and communications have been created, focused on the initial foundation of a more inclusive, equitable, and safe health system. Over the next year, the working groups will expand both in membership and scope as their work continues. So they are working towards improved access to information and enhanced learning, engaging the community, staff, and patient public groups, developing and implementing policies and procedures, and creating and sharing resources. And the committee has many, many members. Charlene Lafreniere, who's the Chief Indigenous Health Officer for Northern Health Region. We also have Dr. Marcia Anderson, who's the Executive Director of Indigenous Academic Affairs. On Golzamin Mezwin, Indigenous Institute of Health and Healing. She's the Vice Dean of Indigenous Health, Social Justice, and Anti-Racism at the Rady Faculty of Health Sciences, University of Manitoba. And many, many members. Doretta Harris, who's the Indigenous Health, Southern Health Sante Sud. Bonita Kaler, Integration Manager, WRHA Indigenous Health. So many members. What I was also pleased was to see the feedback from Dr. Marcia Anderson when our government announced that we would begin collecting race-based data at all our health facilities. So feedback from individuals such as yourself, the member for the PA, Kamisak, and your family member is critical to us rooting out and eradicating these forms of racism and discrimination from our health system. They are not accepted by our government. We stand against all forms of racism and discrimination, and also specifically against Indigenous peoples and First Nations peoples. And we stand shoulder to shoulder with the community against all forms of racism and discrimination. We want it to stop. It needs to stop. And you should not, whether you want to wear a baseball cap and sweats or a 3-piece suit, have to deal with any form of racism and discrimination. And I thank you for speaking up and making your experience and the experience of your family member known. Miigwech, thank you.
The honorable member for Thompson.
Thank you, Mr. Chairperson. I'm curious to know what the 2022 budget specifically for the Northern Regional Health Authority was, and also the current budget for the Northern Regional Health Authority. But the reason why I ask is I'm curious, was the 2022 NRHA budget spent in its entirety? Or was there a surplus or a deficit specifically to the Northern Regional Health Authority? Thank you, Mr. Chair. Go ahead.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I thank the member for Thompson for the question. Can I just clarify the years again, please? Which years of the budget would you like?
The member for Thompson.
Thank you, Mr. Chairperson. The question really is of last year's budget and what the current budget is for the Northern Regional Health Authority. But because the numbers should have been in by now, what I'm seeking here is for last year's numbers, for the NRHA specifically, what their total allocated budget was, and was there a surplus in that budget come the end of the fiscal year, or was there a deficit within the spending thing? Thank you.
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I am able to confirm that the Northern Regional Health Authority in 21-22 was budgeted 224,789,284 in their budget. They spent all of those dollars, Mr. Chairperson. And in the end, the amount that was spent was 230,061,851 for 21-22. I do not have the final numbers for 22-23 because, as you know, we are still operating in that fiscal year that does not end until March 31st. And then the numbers will be available. I do not have 23-24 numbers because that is what we are discussing today in the Manitoba Health budget that has not been approved as of yet by the honorable members opposite. Thank you, Mr. Chairperson.
The Honorable Member for Flin Flon.
Before we close off questioning for today, and I'm sure there'll be many more days where we get to ask questions, hopefully for Northern Health in specific, there's some new health centers, new hospitals being built into the fastest growing communities in Manitoba, particularly in northern Manitoba, Cross Lake and Norway House. So I know that the minister thinks that those are Indigenous communities, so therefore the funding should all come from the federal government because somehow this provincial government isn't responsible for Indigenous people who are Manitobans. Even if one was to accept that particular argument, which we don't, both of those communities have large non-Indigenous communities as well. So can the minister explain to us how much money has been budgeted for construction at those facilities? How much money has been budgeted to install equipment in those two facilities? And how much money is being budgeted to ensure that there's healthcare providers in those two facilities?
The Honorable Minister of Health.
Thank you, Mr. Chairperson. I do thank the member for the question because it gives me an opportunity to talk about some of the visits I've made across the north and across rural Manitoba, where Indigenous people live all across the province. And some of the projects I've had the opportunity to tour, for example, Norway House's Health Center, those projects, we would have to go to them and find out how much money they receive for their projects, because some of those projects are being funded federally, for example, for the construction, for equipment, for healthcare providers. We are coming alongside some of those projects to look at specific areas that within the projects that can be funded under Manitoba Health's budget. We are having those discussions, but if it's specific projects, I think the member will need to be to identify what the projects are that he would like information on, because not all projects that are occurring in the north are being funded through the Manitoba Health budget. So I'm pleased though to be talking with Indigenous leaders and stakeholders and receiving multiple invitations to go and tour some of those projects and see the amazing work that is being done up in the north, supported by our government and supported by Manitoba Health. And construction is occurring, equipment.
The hour being 5 p.m., committee rise.